Hi. So the topic we are going to discuss today is on myofascial pain syndrome. So it is a kind of a chronic condition. Chronic condition means which develops over many months or years. So it's not just like kind of some kind of injury or jerk happens and then you start to get the myofascial pain syndrome. But it is kind of repetitive position or postures has led you into this pain syndrome. Okay, so whenever a person is having myofascial pain syndrome, the term which we call as the knots in the muscle or the trigger points in the muscle, they develop. And now what are these trigger points? So there are kind of various types of knots in the muscle which can happen, but most likely the trigger point is if you press that knot, it will be painful. Okay, and there will be some pain in the referred area, or the area which is kind of distant from the site where the knot is located. Okay, so that referred pain will be experienced along with the tenderness over the trigger point. Okay, so whenever there is a myofascial pain syndrome, the person feels kind of a deep aching pain in the muscles, and along with that you will experience these knots. Okay, and there can be some sleep problems. So whenever the person is sleeping at night, there can be pressure on these knots, and there will be disturbed sleep kind of a thing. Then there can be again, because the myofascial pain syndrome happens over the period of time, so it will persist. Okay, so it won't go away easily. It will persist, or it might worsen with time. So you can see that your whatever activities or postures which has created this issue actually are going to be more and more painful, and you will be having difficulty in holding those positions as well, because the pain is kind of increasing every day. Okay, all right. So if nothing works, then you probably need to meet the doctor. But sometimes when it is kind of very like if you go for rest, or if you do some kind of massage, you might feel some benefits, but at times they might not be very useful. So in such conditions you need to see the doctor. Okay, and various factors which can lead to myofascial pain syndrome are kind of stress and anxiety. So the psychological factors have a role to play here, and also the muscle injury or repetitive muscle use can lead to myofascial pain syndrome. Now this pain syndrome can also turns into fibromyalgia over the period of time. So fibromyalgia is again a kind of very chronic condition, and there are kind of multiple knots which you can feel in your body. Okay, so we have some kind of cutoff, like if you have these specific number of knots in your muscles, then you are kind of having the fibromyalgia. Okay, and fibromyalgia patients or clients also show some changes. So this is kind of a research, or the evidence suggests that there are some brain level changes which happens in patients with fibromyalgia. Okay, so it is kind of again deeper problem. Then how a physical therapy or a physical therapist can help you if you have myofascial pain syndrome. So I have treated many patients with myofascial pain syndrome. We generally do lots of like postural correction for them. So generally around the region where there are knots, the muscles are very weak. Okay, and strengthening of those muscles actually helps. And besides strengthening, there is also kind of, we need to stretch certain structures. So so stretching combined with strengthening of like specific muscle groups can actually lead to correct position or correct posture. So again, posture is, or deviated posture can lead to myofascial pain syndrome. Again, nowadays people are using like computers or desktops so much, and they are mostly sitting with chin like kind of in a poking chin position, which again stresses all these muscles around the neck region, upper back region, and can lead to myofascial pain syndrome development. Okay, and then we do releases for such patients, like for the general relaxation of the body, and also we can use various modalities along with that, and heating can be used. So there are various ways with which we can help the patient. If there is the patient is very chronic, even dry needling can be used, and its evidence suggests that it's quite helpful. So if you feel like you're having myofascial pain syndrome, or knots in your muscles, like at one spot or at many spots, you need to meet the physio, and they can help you figuring out in fixing these problems, and they are kind of preventable. And once you come into the right posture and right kind of a balanced body state, like there are no weaker muscles or tighter muscles in your body, you can help prevent this myofascial pain syndrome. Okay, so with this I would like to end this video, and again I will bring some more interesting topics to you. So thank you so much. Have a great evening. Bye.